Good morning students and welcome back. We will continue the metabolism of carbohydrate, competency number 3.8, and today's topic is interpretation of results of blood glucose and other laboratory investigations like urinary glucose and ketone bodies. Determination of blood glucose level is the most commonly done laboratory analysis. For estimation of blood glucose level, we have to collect either plasma, serum or capillary blood. Out of this, enzymatic method is considered as highly specific and accurate method of estimation of blood glucose level, for which you require either plasma or serum. Blood glucose may be done at any time by collecting a blood sample. Then it is called as random blood glucose. If it is collected in the early morning when the patient have not taken anything by mouth for 8 to 10 hours except water, then it is called as fasting. If the blood glucose level is measured by collecting the blood exactly after 2 hours of meal, then it is called as post meal blood glucose level or postprandial blood glucose level. When we collect the blood sample of a person, at the same time urine sample is also collected for determination of urine glucose and ketone bodies. Determination of blood glucose level in blood. When we draw a blood for estimation of blood glucose level, then we have to add sodium fluoride in a bulb. This sodium fluoride will inhibit the enzyme enolase, which in turn inhibits the process of glycolysis in the whole blood. If fluoride is not added, then the blood present in the cell start utilizing glucose from the blood and you will get false low values of glucose. The enzymatic method is highly specific and it gives true values of glucose. Nowadays you can use auto analyzer for more accuracy of this method. The name of this enzymatic method which are used nowadays is called as glucose oxidase method. The principle of this glucose oxidase method is the enzyme glucose oxidase acts on glucose and converts it into gluconic acid and hydrogen peroxide. Now this peroxidase enzyme acts on hydrogen peroxide, releases nascent oxygen. Now this nascent oxygen combines with 4-amino antipyrine and phenol, which are already present in reagent along with glucose oxidase. When this nascent oxygen combines, they get converted into red color quinone dyes. The intensity of this red color of dye is directly proportional to the amount of glucose present in the blood. So by measuring the intensity, you will get the amount of glucose present in the given sample. Now after performing the test, this is the interpretation of blood glucose level according to WHO guidelines. If the fasting blood glucose level is less than 110 mg per deciliter, then that person is normal. In diabetic persons, the fasting blood glucose level may go above 126 mg per deciliter. But if the fasting blood glucose level is between 110 to 126 mg per deciliter, then it is called as impaired fasting glycemia, and such persons have to go for another test called as GTT for the confirmation. The long form of GTT is glucose tolerance test, which we will cover in another topic. Now the blood glucose level after 2 hours, that is post meal blood glucose level or post prandial blood glucose level values are less than 140 milligram percent, then we can interpret the person is normal. And if the values are more than 200 milligram percent, then we can interpret as diabetic persons. Again, if the values are between 140 to 200 milligram per deciliter, it is impaired glucose, then such person has to go for GTT. In India, the blood glucose level is measured in milligram per deciliter, but in Western countries, the blood glucose is measured in milliosmol per liter. Therefore, I have given the corresponding milliosmol per liter values of blood glucose in this chart. So this is about the interpretation of blood glucose. Now come to the interpretation of urine glucose and ketone bodies. In normal individuals, glucose and ketone bodies in urine are absent. Glucose in the urine is detected by Benedict test. Ketone bodies in the urine are detected by Rothras test. But in diabetic individuals, in fasting state, if the blood glucose level is below 180 milligram per deciliter, then urine sugar is absent. And if fasting blood glucose level is more than 180 milligram per deciliter, then urine sugar is present. This 180 milligram per deciliter of blood sugar level is called as renal threshold for glucose. That means when the blood glucose level increases above 180 milligram per deciliter, then glucose appears in the urine and you will get Benedict test positive. In case of post meal, in diabetic persons, the blood glucose level is more than 200 milligram per deciliter, so you will get Benedict test positive or glucose is found in the urine. Now come to ketone bodies. In normal individual, ketone bodies are absent. In diabetic individuals, the ketone bodies may or may not be present in fasting state or post meal state, depending upon the type of diabetes. In type 1 diabetes, it is more prone for ketosis. Therefore, oftenly you find ketone bodies in the urine of type 1 diabetic persons. But in case of type 2 diabetes, if the blood glucose level is very high, more than 500 milligram per deciliter, generally this patient of type 2 diabetes mellitus also shows presence of ketone bodies in the urine. So this is about the interpretation of blood glucose, urine glucose and ketone bodies. Thank you very much.